Well, we're back right here in the studio, and I hope everyone out there is having a very nice evening wherever you may be watching tonight's episode of Hala Kuwait. Right now, we have a phone call with Reem Almatrook, and Reem is a specialist pediatric diabetes dietitian at Dasman Diabetes Institute. Good evening, Reem.
Good evening.
Reem, could you tell our audience about your job with the pediatric patients at Dasman Diabetes Institute, which was established by the Kuwait Foundation for the Advancement of Science?
Yes, sure. So I'm a pediatric dietitian, and the role of the dietitian in type 1 diabetes is very important because the management of the disease is directly related to food. So the more the patient understands their food, the better they can manage their blood sugar. So this is because the insulin that they take on a daily basis goes hand in hand with how much carbs they're eating in the day to avoid highs and lows. So basically, my job is to teach the patient how to count the carbs in their meals so that they're taking the correct insulin doses.
Excellent, Reem. So what is the main problem the children are facing, especially these days, Reem?
So with the current political situation, most children are at home doing online school. And this, unfortunately, has really lowered their activity levels. So the most common problem right now in the clinic is that many children are facing insulin resistance due to this lack of movement. So what this means is that the insulin that they're taking is not doing a good job of lowering their blood sugar. So they end up with high blood sugars all day, and they need more and more insulin to lower it.
Okay, Reem, I believe, routine is something important, especially for the youth, the children, where they have, they get up, they go to school, they have their study time, play time. So how is the lack of routine affecting blood sugar?
So, yes, as you said, routine is very important. Once the routine is thrown off and people are sleeping less or changing their sleeping cycle, this also prevents them from having routine dietary habits and prevents them from doing the correct insulin calculations. So now this is also leading to high blood sugars as well.
So what can they do to prevent this, Reem?
So the most important recommendation is to really try to prioritize exercise during this time. So according to the guidelines, children need at least 1 whole hour of continuous activity per day. So if the families are comfortable going out, I would really suggest outdoor activities while the weather is still pleasant. So this can look like biking, walking outside, going to playgrounds or parks. But if families prefer staying home, there are also different ways to get the kids moving at home as well.
Maybe you could tell our audience about that, some tips to help them stay more active at home, please.
Yeah, so now there are a lot of applications on the phones that are children-focused fitness apps. So they can try downloading these, or they can watch any guided videos online for activities that are more fun, because children are more likely to exercise if it's fun. So they can find videos for guided dancing, martial arts, cardio, even walking in place. There are videos to, for example, walk in place to get 5,000 steps, for example.
Okay. So they can find this all online, YouTube and so forth?
Exactly.
Okay,
exactly.
Great to hear that. So, Reem, another important topic is sleep. So how important is that, especially during this time period when, the sleeping patterns may be a little off?
Yeah. So sleep is very important because it balances the regulatory hormones that we naturally have in our body, like adrenaline, growth hormone, cortisol, the stress hormones. So if sleep is not enough, if it's not adequate sleep, or if it's very erratic, this really affects insulin sensitivity. So that, again, the insulin that they're taking will not work as well as it would usually if they were getting adequate amounts of sleep in a routine way. So that's why it's always recommended that children get around 8 to 10 hours of sleep at a specified bedtime and wake up time so that we can support normal insulin sensitivity levels.
Some very good tips right there. And do you have any last bit of advice, especially for the parents who may be watching right now during this period where, you know, the schedules may be a little off, the routine is not the same way it used to be. So any bit of advice for the parents to help with their youngsters?
Yes, sure. I would advise, if people are not going out much, if you can make use of things that you have at home that can encourage exercise. For example, if you have a pool at home, you can encourage swimming workouts. Or if your house has a gym or a treadmill, you can set a daily goal of walking, for example, 30 minutes per day. Or we can use toys such as jump ropes or hula hoops or playing football in the garden. So even if you don't have anything at home, just like a simple 15-minute walk around the living room after meals has also been shown to lower blood sugar levels.
Well, Reem, we'd like to thank you so much for your time with us this evening right here on Hala Kuwait. And we wish you and all your colleagues at Dasman Diabetes Institute all the best of luck in your future endeavors. Thank you.
Thank you so much for having me.
Thank you very much. We'd like to thank our distinguished guest, Reem Almatrook, Specialist Pediatric Diabetes Dietitian at Dasman Diabetes Institute, for her time and valuable insight this evening right here on Hala Kuwait. Right, move on to another one of our reports that we have for you this evening right here on the program. And we're going to take a look at this report about Radio of Kuwait. So Radio Kuwait, stay tuned.